An ABC 15 follow-up on our 48 Hours on the Border series. Last year, I reported from Yuma as that community dealt with an influx of migrants seeking asylum. More than a year later, with crossings at historic lows, I wanted to check back in with the Regional Center for Border Health, who helped transition nearly 250,000 people, to see what they're up to right now. It is hard to ignore the constant hustle and bustle you'll find here in San Luis, Arizona. Whether on foot or on four wheels, there is a constant flow of people back and forth between the U.S. and Mexico. According to recent numbers from the Greater Yuma Port Authority, roughly 2.3 million people and nearly 3.3 million vehicles cross through this port every single year. Not to mention the 45,000 full-time residents in the city. But as San Luis continues to grow, so do their needs.
This community has been disadvantaged in terms of receiving access to care.
Which is why Amanda Aguirre, president and CEO of the Regional Center for Border Health, is behind a new hospital. Right now, the closest one is in Yuma, a trip that often takes at least half an hour.
If you have a car, if you have to take a taxi, you have to pay for that $50 a trip.
¿Cuál es la meta? ¿Qué quieren hacer aquí? We profiled Aguirre and the Regional Center last year as part of our 48 Hours on the Border series. The group operating a transition center for migrants after they were processed by the Border Patrol. But now that we're seeing much lower numbers here at the border, the Regional Center is onto new projects like this hospital. They broke ground back in January.
It's really easy to get backed up.
Last year, I also spoke with the San Luis Fire Department, who told me transporting patients all the way to Yuma can take up precious time and resources.
Our turnaround times from we go from San Luis to the hospital is 2 hours, and we still have to continue providing emergency services to our residents.
El hospital está muy lejos, ¿no?
Sí.
Residents like Ángeles Fabián.
Va creciendo también la ciudad y pues está creciendo el poblado y pues sí es muy buena opción que esté un nuevo hospital aquí en San Luis.
So Ángeles tells me that the population is growing here, the city is growing, so having that new hospital is really going to be a good option. As a mom of two, she says you can't put a price on the peace of mind of knowing help is just down the road. Esa opción como mamá ya te pone menos preocupada, más tranquila.
Más tranquila, sí.
So Ángeles tells me as a mom, having that option of the new hospital makes her feel at least a little bit less worried when those accidents do happen. And that hospital will feature an emergency department, diagnostic services, even a pharmacy, and can expand as the community continues to grow there in South Yuma County. In the meantime, you'll want to tune in tomorrow morning as the fight over funding continues for Aguirre and the Regional Center for Border Health. That transition center they operated helped nearly 250,000 asylum seekers, but Aguirre says they're still owed millions of dollars. I'm getting to the bottom of this. That's coming up tomorrow right here on ABC 15 Mornings.